Namaskar and welcome to Apollo 24/7's Health Hour. This is a show where we bring Apollo's health experts every Sunday to this live show where you can ask all your questions and queries. You must be watching this on Facebook pages and YouTube channel as well. If you want to ask any questions, please do hop onto YouTube channel where you can ask your questions in the chat box and I shall place these questions before our expert today. And on the show, you also can expect to win gift coupons. We are going to give away gift vouchers, and also there's going to be a health quiz where you can participate and win prizes from Apollo 24/7 as well. By the way, before I start the show, let me congratulate all our winners. Last अब तक जो भी winners हमारे हैं health quiz के, all of you congratulations, and especially last week के जो winners है ताजिंदर सिंह, अनमोल रतन सिंह and Mr. अनमोल अग्रवाल, आपके health credits, आपके जो प्राइजेस है वो आपके अपोलो 24/7 के अकाउंट में हेल्थ क्रेडिट्स क्रेडिट किए गए हैं. Congratulations once again and hope that you all participate in our health quiz and win prizes from Apollo 24/7 as well. तो चलिए आज के हमारे टॉपिक के बारे में बताती हूँ. We are going to talk about how to fix teeth problems. So let me introduce our guest for today. We are going to have an expert, Dr. Amita Agarwal, Senior Consultant and HOD Dentistry from Apollo Medics Super Speciality Hospital, Lucknow. कोलकाता से मैम आने वाले हैं, लखनऊ से आने वाले हैं. So let me also take your time to tell that ma'am has more than 34 years plus of experience. Dr. Amita Agarwal can be consulted for smile designs, dental veneers, trauma, RCTs, crowns and bridges, teeth whitening, aesthetic fillings, and child-related dental problems as well. And here's ma'am. Good morning, Amita ji, and welcome to the show. And I know that you are very senior in your department, in your wing, and you head the department. And also, you are awarded several awards and medals. Itne sare hai. It's our pleasure to have you on the show, ma'am.
Thank you, thank you, thank you, Jhansi. It's a pleasure to be on this show too.
Yes. Thank you, ma'am. Ma'am, I think, when I want to start about teeth, हम पैदा होते हैं बिना टीथ के, और जो ऐसे एज बढ़ता है ये टीथ शेड होते हैं, फिर आते हैं, फिर जाते हैं. सो ये आने जाने के बीच में हमारे जो ओरल हेल्थ का, हाइजीन का जो भी इम्पोर्टेंस है, do we have, has the humankind learned to take care of a set of teeth well, or are we still lacking in our oral health?
Jhansi, सबसे पहले तो I would like to tell you that many times children are born with teeth also.
Oh really? Okay. Yeah,
Yes,
one or two. Yes, yes. हाँ, वो तो
yes.
सुना है
Those,
कभी. हाँ.
those teeth are called natal teeth. When a
Ah,
child is born with teeth, most of the times it is in the lower incisor
okay.
region. So they are
Yes.
called natal teeth. And many
Okay.
times teeth erupt within 1 month of the child being born. Those are known as neonatal teeth.
Acha. Okay. Okay.
As only yesterday, I extracted a small tooth, a child, a newborn baby, 1 month old. She got neonatal teeth, and because it was mobile and the patient mother was having difficulty in breastfeeding because of the trauma, so
जी.
I extracted that neonatal tooth only yesterday.
Oh
So, but
my.
that is quite uncommon, not very common.
जी.
And
जी.
then then when the child is 6 to 7 months of age, the milk teeth or the deciduous set of teeth start erupting, which continues up to 3 years of age. Till three
Okay.
years, all the 20 milk teeth have erupted. And then uh, after 6 years, the permanent set of teeth start erupting, which erupt till about, say, 21 years of age. So now
जी.
it is very important to take care of milk teeth also. There is a big myth that everyone feels that because the teeth will fall off, so it is not so important to take care of the milk teeth. But that is a very, very big misconception, and people should take care of milk teeth also. And the
Okay, ma'am.
most common cause of decay in the milk teeth is bottle feeding at night. Infants, if
Hmm.
1 years or less than that, they are taking bottle feed at night, going to sleep with the bottle in the mouth, and the milk has sugar, and throughout the night, that milk is there around the teeth, and that causes very, very rapid destruction of
Teeth.
almost all the teeth, and that is called rampant caries.
जी
So,
जी
especially for children, it is very important for mothers to brush the teeth and not they should not be given bottle at night. And if they are giving
Okay.
bottle feeding at night, then the teeth should be cleaned, if not with a brush, then at least with a damp cloth, or they should avoid putting sugar in the milk if the child is bottle feeding at night. That is a
Okay.
very, very important factor which causes widespread caries, and almost all the teeth are decayed at a very, very
Yes.
young age.
Yes, ma'am. While you're talking about children, I see a lot of people have joined us already on the YouTube chat. Prince Bhatia ji पूछते हैं, what interval should one change toothbrush? And also a lot of people are asking about health. Ki why do we keep getting bad breath even after brushing morning and before going to bed? This is Raymond's question, ma'am. So
Okay.
toothbrush क्या frequency में change करना चाहिए? That's Bhatia's question. And then Raymond is asking bad breath despite of brushing twice.
Okay, okay. So, Mr. Bhatia, I would like to say that there is no time fixed as such that you have to change the brush, but normally 3 to 4 months is a good time when you should change your brush. And if you are brushing, your technique of brushing is proper, then the brush does not get bad so soon. And if we are not brushing properly, our technique is faulty, then many people say that even in 1 week, the bristles all go haywire and they have to keep changing the toothbrush. And yes, one
Yes.
important thing that we should never use a hard brush. The toothbrush which we use should be soft, or for some patients, they should use a brush with super soft bristles so that it does not damage the teeth.
Okay. Also, Harminder Singh Chauhan ji, same question पूछे थे, then you've already answered. And yes, the bad breath is despite of brushing twice.
Yeah, because what I would like to say is that brushing just cleans 95% of our oral cavity. The spaces in between the teeth, they cannot be cleaned with a brush. So for that, we need to floss our teeth regularly. People may be knowing what a dental floss is. It is a thread-like thing which we clean for the interproximal areas, or the areas in between the teeth where brush cannot uh, reach. So,
Yeah.
the cause of bad breath, even if you are brushing 2 times, it may be there because you may be having dental gum problems. There may be pus discharge from gums, or many people. There is one more cause of mouth breathing. Oh, sorry, one more cause of bad breath. Many people
Order.
are mouth breathers. They are mouth breathers because of some
Ah,
problem in the nasal cavity. They are not breathing through their nose. They are breathing through their mouth. So dryness of mouth causes a lot of bad breath. So
hmm.
many people are not aware of this, that mouth breathing also causes bad breath. So
Yes.
if the person is a mouth breather, then they should go and show themselves to an ENT specialist to see whether the nasal cavity, nasal passages are patent or not. Why is the person not able to breathe through the nose? That means there is some problem in the nasal
Okay.
passages.
That's a very very interesting observation that you made, ma'am. So one has to observe कि हम नाक से breathe कर रहे हैं या मुंह से breathe कर रहे हैं.
Yeah,
Is that?
and the best way is just close your lips for 2 minutes and then see. If you have distress in breathing, that means you are not breathing through the nose. That means you are breathing through the mouth. That is the best way to check. Just hold the lips like this for 2 minutes and try and breathe through the nose. If you feel discomfort, that means you are a mouth breather.
Ma'am, can I ask you something? Somebody like me who's in a profession where I keep talking all the time, मेरा तो मुंह बंद रहता ही नहीं है because of my profession as well.
हाँ,
तो मैं
हाँ।
अपने आप शायद मैं मुंह से भी breathe करती हूँ than the nose.
नहीं, नहीं,
Unless
नहीं,
it's constantly, will that also be a
Jhansi,
problem?
When you are talking, then you cannot breathe. You cannot talk and breathe at the same time. So when you are
Okay, ma'am.
talking, that means you are breathing through your nose only.
Okay, great.
You are
Thank
breathing
you, ma'am.
directly.
Yes. Here's another question about Veer, your buddy Veer. Uh, शायद flushing बोला है इन्होंने, but I think it is flossing. How to do
Okay,
flushing पूछा है इन्होंने, but I understand it is flossing.
okay, okay. So we Flossing, it is a thread like thing. You have to wrap it. It is mentioned on the floss itself how you have to use it. I don't know how I will tell you here. You have to wrap it around your index finger and then put two middle fingers over that tight thread and put it in between your teeth. Take it in and out and then take it out. And for
Okay.
upper tooth, you have to put your thumb and put it like this so that it goes between the teeth right up to the gums. Take it out one or two times and then take it out. Sometimes people may find it a little tedious. So now we have got water flossers also. They are available in the market or you can buy them online. They cost about 2000 rupees and they are a very, very effective way of cleaning interdental areas. If you are finding flossing a little tedious, you should buy water flossers.
Ma'am, will everybody require flossing, or is it only specific conditions that require daily flossing?
Everyone should floss the teeth. Flossing should be done by
Daily?
everyone, daily, everyone. You should also floss your teeth.
I do it
Every
occasionally, thinking that only when I've had such a certain fibrous kind of food, or I have additional cleaning requirement. So I'm at wrong. Then I'm thinking
Yeah,
wrong.
we should all brush our teeth two times a day and floss
Okay.
once at night. So for after dinner, first we should floss our teeth and then we should brush so that when we go to bed, our mouth is absolutely clean. So actually, what we recommend is, according to the ADA recommendations, American Dental Association, that we should brush two times a day for 2 minutes, and ideally, brushing should be done after breakfast and after dinner.
Oh,
We should
okay.
brush so that once we have had our breakfast and then we are going to work. So then we should brush our teeth because then after breakfast we are not eating for quite number of hours for 4 5
Longer.
hours. So yeah, for longer periods. So our mouth will be absolutely clean. And at night also we should brush because then 10 hours when we are sleeping, our mouth is absolutely clean. That is the most important thing, which people normally do not follow. They brush in the morning and then they have their breakfast and they rush to work.
Yes, ma'am. So here's Vishnu Kundapalli who's asked a couple of questions, ma'am. Vishnu is asking about how do we prevent gradually reducing enamel, and 30 plus के age में कैसे मैं teeth को protect कर सकता हूँ, and any paste which can maintain good oral health.
Okay, Vishnu, very good questions you have asked. Uh, Enamel, the most important thing is that, as we all know, enamel is the hardest thing in our body. It is the hardest thing. But there are some conditions which cause degradation of this enamel also. So, at a young age, there are one or two things that we should consider. Over brushing our teeth is also very bad. If we are over brushing our teeth and we are scrubbing our teeth hard like this, then what it causes it causes enamel to wear off.
जी.
It causes abrasion and it causes cavities. So that is at a young age, if a person has enamel wearing off, that means either they are brushing too hard or they are using a very hard toothbrush, or they are putting too much pressure and scrubbing their teeth like this, which is a big no no. We should always use circular movements clockwise and anti clockwise and not scrub our teeth hard because that causes wearing off enamel. And the other thing is that people who are taking a lot of lemon juice, nibu pani, or
Yeah.
carbonated
Is it?
drinks, that also causes wearing of enamel, and then they will start having sensitivity at a very early age. And of course,
Ah.
chewing of supari and all should be avoided. That
Ma'am,
cause
smoking?
smoking will not cause abrasion or will not cause attrition. It will not remove the enamel as such, but then it will cause deposits. Nicotine stains will develop, and it will lead to gum issues.
Right. All right, so while you're also talking about, I would want to sensitivity के बारे में, Sean David जी यहाँ है, 65-year-old male है. Whenever I eat anything sour, my teeth pains throughout the day. Please suggest a remedy. Sensitivity है ना मैम?
Sensitivity, yes, sensitivity can be because of many reasons. Maybe he's having some gum issues. He's having um, infection of the gums, which is called periodontitis. So if there is infection of gums, then also it causes roots of the tooth to get exposed, and then whatever you eat or drink, whether hot or cold, or especially if you take any sweet things, they also cause a lot of sensitivity. So for that, he should get a dental checkup done. If cleaning is required, he should go in for cleaning of teeth. And there are sensitive toothpastes. Those toothpastes can be used regularly, at least
Yeah,
for some
he is a
time.
regular viewer on the show. He's a regular participant. So if I remember, he's also a diabetic. No, so can we take some time here to talk about diabetes and health issues, dental health issues, ma'am?
Yes, 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 definitely, definitely. As what I would like to tell you, Jhansi, is that our oral health is a window to our general systemic health. There are many
Correct.
conditions. There are many conditions which we can, by seeing a patient's mouth, we can diagnose that he is
Correct.
suffering from these problems. For example, depression. By looking at a patient's oral cavity, we can tell that he is having depression or
Right.
stress or diabetes or osteoporosis. So diabetes is affects the dental health in a big way, especially the gingival health or our gum health. Because
Gum.
when gums, it affects gums a lot. And so if a patient is a diabetic, then even if he's having a small problem, it will be he will have a lot of problem with because of that diabetic.
Yeah.
He's having sugar, increased sugar in his blood. So infection will be many folds, infection will increase in a diabetic patient. So they have to be very careful about their oral health. They should regularly visit a dentist, get cleaning or scaling done, and maintain meticulous oral hygiene, because a small problem, small infection will give them a lot
Lead
of
to a
problem.
yes, and also to maintain your oral health ke saath saath, because it's a gateway which is trying to tell you the other health, the system's
Yes,
health. There are a lot of packages, especially tests curated by Apollo doctors. There's a ticker running called 1-800-572-1111, where you can book tests at the convenience of home, and also a lot of doctors can be consulted online through Apollo 24/7's online platform. So, ma'am, let's continue with questions here. Here's Venkata Naveen. Naveen is asking, is it possible to replace silver fillings with white fillings?
yes, Naveen, definitely. Because I have been in practice for the last 34 years into active practice. So when I started practice, composites, white fillings or aesthetic fillings are basically composite fillings. So it had just come into the market, because we were doing only silver fillings then when I had started my practice. And but now silver filling is a big no-no. We all have shifted to composite or aesthetic fillings. So if you have got silver fillings, you can get the silver filling removed and get it replaced with an aesthetic filling. So it is much better. It is much better than a silver filling. He can
Wow.
definitely, yes, Venkatesh, you can definitely get them replaced, your silver fillings replaced.
Great, ma'am. Thank you so much. I will also want to take time here about root canal treatment के बारे में बात करेंगे, ma'am. Mr. Mahendra Kumar has asked this question. How often do we need to change the cap after root canal treatment?
Mr. Mahendra, we nowadays we are getting very good crowns are being made. We are using pure porcelain or zirconia crowns, or we are using porcelain fused to metal crowns. So when we are doing zirconia crowns, we give them a warranty of 15 years, but they last much more than that. So if the crown is intact, if it has been well made, we do not need to replace the crowns unless and until it gets fractured. But
Right.
otherwise, you don't need to replace the crown if it is not
Oh,
fractured.
right. And if somebody requires additional information from Dr. Amita Agarwal, ma'am का link हमने description box में डाल दिया है, and also there are messages which are pinned in the chat box, and her link to her appointment is also given. We can consult her online later. मैम, रूट कैनाल ट्रीटमेंट जो हम बात करते हैं, इतना हम सुनते हैं, व्हाट कैन वी टेक सम टाइम हियर टू टॉक अबाउट रूट कैनाल ट्रीटमेंट? ये होता क्या है और किन को जरूरत पड़ता है? व्हाट इज द ट्रीटमेंट ऑल अबाउट?
ओके, तो देखिए झांसी, ऐसा है कि वी ऑल नो दैट वी हैव, इफ वी आर नॉट केयरफुल वी गेट cavities in our teeth, right? So now cavities, when they start initially, they are painless because they are present in the superficial part of the tooth, and superficial part of the tooth, that is the enamel and dentine, it does not contain nerves. Dentine contains nerve endings, but enamel does not contain nerves. So a person will be having cavity, he will be having some problem because of food lodgement, but he will not be having any pain. So what happens is people tend to just ignore it, thinking that it
Ignore.
is, they just ignore, and the cavity, even if there is no pain, but it will keep on going deeper into the tooth, destroying the tooth. So below the dentine, inside the tooth, is the nerve endings or the pulp is present. So once the cavity has reached up to the nerves, then it becomes very painful, and then the people rush to get treatment done. So then what treatment is required? Then we have to do a root canal treatment. But a root canal treatment can be avoided if people come at an early stage when there is a cavity with no pain, and then just a simple procedure, single sitting, simple procedure of 15 minutes will rectify everything. But we just keep postponing it because of pain, fear of pain, or anxiety, or number of sittings, or people fear that root canal treatment is expensive. And if we do not ignore our problems, then it can be done at a very simply and at very cost effective manner. But then once the infection has reached up to the nerves, then a root canal treatment has to be done, in which we remove all the nerve endings, all the blood vessels from inside the tooth, clean it up, sterilize, disinfect it, and fill it up with some inert filling material, which is, and then give a filling over it. And then once the filling has been done, then over the filling, we have to give a crown, which is mandatory. That is also, I would like, on this show, I would like to tell everyone that whoever does gets a root canal treatment, they should definitely go in for a crown. They think that once the filling has been done, everything is fine, they don't need a crown, but crown is mandatory because what happens is the tooth becomes brittle after a root canal treatment, because we have removed all the nerves
Pulp.
and all the blood vessels and the pulp, so the tooth becomes brittle. So what happens is the tooth will fracture after some time if a crown is not given. And this is the most common thing. People will get a root canal treatment, and they just avoid getting a crown for whatever reasons, and the tooth fractures, and then entire procedure, entire everything goes waste, and the tooth has to be extracted.
Okay, ma'am. Thank you so much for giving this information there. Next question I would want to take up is Divi. Divij. ये पूछता है कि should we not take any sweets or chocolates at all because it causes caries?
Okay, Devish, you have asked a very good question, because everybody keeps telling children that don't take sweets, don't take chocolates. But I would say no. You can definitely take sweets and chocolates. What we advise is that we should take 3 sugar exposures in a day. And sugar exposures, if we take tea with sugar, that is also counted as a sugar exposure. So three sugar exposures are allowed in a day. So what I would like to tell Divij is that we should, and everybody else also, whoever is watching this show, that we should use these sugar exposures intelligently. Intelligently means that eat whatever you really love. Don't waste your sugar exposures. So if you are fond of eating sweets, then try and avoid sugar in tea or coffee, and so that you can eat sweets. And even if you are eating sweets, if you want to have 3 laddus, then have them at one go, at one sitting. Don't eat those 3 sweets at 3 different time intervals, because then it will damage your teeth. So you can have 3 sugar exposures every day, and try to avoid infrequent snacking in between. Frequent snacking is bad. So 3 times you can have, but make sure that you brush 2 times every day and floss at night.
Ma'am, how about rinsing after everything, each time that you either eat or snack? Will that help?
It helps, but it is not a substitute for brushing. If people think that they have at night, okay, ma'am, I didn't brush, but I rinsed my mouth well. It is okay. It is doing some good, but it is not a substitute for brushing. So at night before going to bed, we should all make it a habit that we have to brush our teeth before going to bed. So rinsing is not enough.
Okay, ma'am. Thank you. So next question is about a child who's 15 months old and he's on mother's feed even in the night. His teeth have started decaying. How to treat this? Kindly suggest. This is Kate who's asking the question.
Kate, as I just said, breastfeeding or bottle feeding at night, especially at night, whenever the child cries, the mother will just breastfeed the child. And milk will be there sticking around the teeth. And that is the worst thing because that causes a lot of decay. And teeth in children are very soft. So the caries spreads very fast. And in a month's time, all the teeth, the entire dentition would be decayed. So when the child is 1.5 years old, you should try and see that the child takes dinner. The child is able to eat. So the child should not only be on breast milk or only on milk. The child should be given proper dinner at night. And then if the child wants, then you can give the child milk, but make sure that you wipe the child's teeth. Even if the child has gone to sleep, take a damp cloth and with your finger just clean the teeth of the child, even if he's sleeping. But make it a habit. Try and make giving dinner to the child so that his dependency on milk will reduce if he's taking proper dinner at night. And then you can
Yes.
supplement it with milk and then clean the teeth. That is
So
very
why
important.
we say that breast milk is a blessing? We also need to give the blessing to the child कि वो आप dental health at a very tender age भी एक blessing है जो आप दे सकते हो by
Bilkul.
avoiding breast milk at certain times.
And then
Right,
if the
ma'am.
child is taking, yes,
Yes. Please continue, ma'am. And then if the
the
child is
child is
taking
taking proper dinner, then slowly his dependency on breast milk will decrease. Because
naturally, yes.
if the child is only on breast milk, then of course we will have to give him breast milk whenever the child is hungry. But try and
Yeah.
switch to solid foods.
Yeah. Ma'am, here is again a young child's question. 7 month, 7 year, I'm sorry, ma'am. Jia Shri है इनका नाम, female है, teeth not regrown even after 3 months. What can be done?
Sorry, I didn't understand the question.
The question is, जो milk teeth shed हुए हैं, 3 महीने
Okay,
हो गए हैं, अभी उनके teeth फिर वापस नहीं आए हैं.
okay, okay. What is the age of the child?
7 is what I see. I'm not sure if that's
Then
Jia
it
Shri
must be
is seven.
7 months. 7 years. It must be
7 years
years.
होंगे मैम, 7 years
Huh.
होंगे.
Okay, Jia, don't worry. The teeth will come. You don't need to worry about it. If it has been 3 months, the teeth sometimes they take 6 months to erupt. So you don't need to worry about that at all.
Okay. Nidhi's question, ma'am, next. I feel that my bad breath has to do more with a throat problem. Any ideas?
Yes, yes, yes. Problem of the throat can also lead to a bad smell, halitosis. So yes, that can be a reason. Then she should show an ENT surgeon for that. It also
Okay.
causes halitosis or bad breath. Yes.
Indigestion की वजह से भी होता है मैम? How's the relation between
Indigestion की वजह से there are a lot of problems which occur in the oral cavity. Indigestion is a very, very bad thing as far as oral health is concerned. It causes a lot of generalized ulcerations in the mouth and a lot many problems. So,
Okay.
but I don't think it may, or regurgitation may cause bad breath, but not, I don't think indigestion will lead to bad breath as such.
अच्छा. Not the breath, but other oral health issues,
Yes,
indigestion.
yes, indigestion,
GERD,
direct.
GERD जिनको होता है, gastro
Yes,
esophageal
yes, yes,
reflux.
yes. reflux, it damages the teeth a lot. It causes erosions of teeth. All the enamel is worn off. It wears off because of the acid. So most of the acidity is a very, very bad thing for the oral cavity, and it should be taken care of. It should be treated.
Yes. Yes, ma'am. Here's again, we're coming back to seniors questions, ma'am. Mr. Mehrotra. ये पूछते हैं, my teeth enamel is decaying, which is to be cured or controlled because he's 62-year-old. What to do? Kindly advise. Thank you in advance. Ma'am, also after you answer this question, I would want to ask about ये जो elderly season होता है इनका भी झड़ते रहते हैं या lose हो जाते रहते हैं. We'll talk about that also simultaneously, ma'am.
So, Mr. Mehrotra, for he's 62, I would like to ask you, has he got any other systemic problem?
Yeah, like
Because
diabetes, ma'am. What else
like
would you
that,
want to?
or he may be having a habit of grinding his teeth at night, or he may be having some sort of stress, because there are many things which can cause enamel to wear off at 62
Yeah,
years.
Mr. Mehrotra, please type your. अगर मैम आप सुन रहे हो, अगर आप यहाँ हैं तो it will be helpful if you can type. In the meanwhile, let's continue to answering the question, ma'am. Let me see if we can type.
Okay, okay. So you were asking about senior citizens.
Yes, ma'am.
So,
Senior
so
citizens and जो कभी कभी पहले ही पूरे दांत निकलने से पहले 1 or 2 teeth are also lose. तो इनको हम कैसे रिहेबिलिटेट करना चाहिए एंड किसको रिहेबिलिटेट करवाना चाहिए?
actually, Jhansi, see what I have seen over the last 34 years that I have been into practice. These days, in the last 5 to 7 years, I have seen that a lot of senior citizens now come to me for their full mouth rehabilitation. And I think that the reason for this is that now the longevity has increased. People are very particular about their teeth. The quality of life of people have improved a lot over these 30 years. And so when a person retires at 60, now he feels that he is self-sufficient, he is not dependent upon his children, so they would like to spend money and time for their improvement of their
Yes,
overall improvement. So dental
yeah,
health is one of it. So now people at the age after the age of 60, they want to have a full set of teeth, and so now for that we go in for full mouth rehabilitation. In this, we do fillings wherever it is required. We do root canals if it is required. And missing teeth, if there are missing teeth, then all those missing teeth also are replaced. And so that the person can eat and drink effectively. And all these things, if a person has a full dentition, it affects the overall health a lot. People who do not have teeth, they have got a lot of problem with their GIT upsets they have constipation, they have got a lot of oral ulcers, and general health is not good in patients who don't have teeth. So now I would suggest that people should definitely, if they have missing teeth, if they do not have teeth, the patient will come to me. Normally, the patients don't come, their children will bring their mother or father that they don't have teeth, but they are very happy without teeth. They are saying that they are able to eat everything. But actually, gradually, when the teeth start falling, the body just gets accustomed to it. But a person who has no teeth is not able to eat everything. So
correct. Not all food, please.
they are not able to eat all the fruits, the vegetables. So diet is very much restricted. That causes their GIT upsets, and then overall general health deteriorates a lot. So
यस यस सो
even
मैम ये अगर मिसिंग टीथ को कोई बीच में गैप आ गया है, एक टीथ नहीं है करके जो करता है, दैट्स द प्रॉब्लम वी आर टॉकिंग अबाउट कि एक टीथ
yes.
नहीं है बाकी दोनों है आजू बाजू है तो मैं चला लेता हूँ काम. ये एटीट्यूड यू आर ट्राइंग टू टेल दैट दैट्स नॉट गुड इन अ लॉन्ग रन.
Long run, because what happens if teeth are missing and you don't replace the teeth, then the other teeth will start coming in, closing the gap. So gaps start coming in between the other teeth also. So then
जी.
that will lead to periodontal problems, and then the teeth will start loosening up, and then they will start falling off. So even if one tooth is missing, I would suggest that you should definitely get the tooth replaced. And then there are many ways of getting the tooth replaced. You can get removable dentures, or you can get fixed dentures. So there are many ways in which a missing tooth can be replaced. So that will depend on what the person wants, or on many things, on many factors. It depends what are the
Yes, ma'am.
different ways of replacing teeth.
जी, चेतन कुमार परमार जी, आपने क्वेश्चन पूछा है, मेरे दांतों के अंदर और मसूड़ों में भी बहुत दर्द होता है, तो रातों में नींद भी अच्छी नहीं आती है, प्लीज सजेस्ट कीजिए क्या करूं।
Mr. Chetan, the first thing you should go do is visit a dental surgeon. So the dental surgeon will take a X-ray of your entire dentition, which is known as an OPG or orthopentogram, in which we get all the teeth and gums and bone, and then whatever treatment is required, please get yourself treated at the
हाँ,
earliest.
तो सबसे पहले आप डेंटिस्ट का विजिट कीजिए चेतन जी, उसके बाद में वो बताएंगे कि प्रॉब्लम मसूड़ों में है या दांत में है, कुछ कर पाएंगे या नहीं कर पाएंगे। एंड मैम, वन क्विक थिंग मैम, डेंटल विजिट्स इमरजेंसी में नहीं करना चाहिए। डेंटल विजिट्स आर जनरल विजिट्स दैट यू हैव टू स्केड्यूल,
Yes,
दैट इज
yes.
समथिंग दैट वी ऑल नीड टू टॉक।
Yes, yes, वही तो, that is the main thing, no? Because I don't know why लोगों को बहुत misconception. They just try avoiding going to the dentist. So there are many reasons for that. Maybe they are very scared of a dentist, or maybe the cost factor is there, or maybe they think that they will need to go for multiple sittings is required. That there are many reasons why a person keeps avoiding going to a dentist. But what I would like to say on this show is that if you go for regular visits, then if there is a small problem, it will be taken care of immediately. But if you
जी,
just leave it, it will lead to greater problems, number
एंड
of
लार्जर।
visits will increase, and everything will increase.
Yes, ma'am. Next question is Vamika Arora. How to get rid of yellow teeth?
Vamika, now there are many causes of yellow teeth. It can be because of many reasons. If there is increased fluoride in water, that will also cause yellow teeth. That is called fluorosis. If you are not brushing properly, then there will be a thin layer of plaque. So that will also cause yellowing teeth. If a person is smoking, that will also cause yellow teeth. If you are taking a lot of tea, coffee, then you will have these stains on
For
teeth.
sure.
So there are many reasons for these for yellow teeth. So it depends what the problem is, and accordingly, if you're not brushing properly, then simply by just brushing your teeth, your your teeth will become white. So actually, first we have to see what is the cause of that yellow teeth, and accordingly, then we can go in for bleaching or teeth whitening or scaling, polishing, whatever is required will be done.
Yeah. And Nidhi's question, ma'am. Nidhi Kohli. Uh, Non-fluoride toothpaste, are we supposed to, are not supposed to be used? मुझे क्वेश्चन समझ में नहीं आया मैम, क्योंकि वो क्वेश्चन सही ग्रामेटिकल इसमें नहीं है, बट नॉन फ्लोराइड टूथपेस्ट आर नो सपोज टू बी यूज्ड, क्वेश्चन
Or
मार्क।
not, maybe she's asking whether
हाँ,
non-fluoride, suppose
या
we should
मेरे,
not. See, actually the thing is now it is always better to use fluoridated toothpastes, because fluoride, it strengthens the teeth. So if you have cavities, they will become stronger and they will not decay so fast. So ideally, we should use fluoridated toothpaste, but it is, you can use a non-fluoridated toothpaste also. It will clean the tooth. It will clean the tooth as with a fluoridated toothpaste. The only thing is that because it does not contain fluoride, it will not strengthen the tooth against dental cavities. But
यस
so ideally, we should all use fluoridated toothpaste, except for children. Children below the age of 3 years, because children are not able to spit out the paste when we are brushing their teeth. So for children below 3 years, we should definitely go in for a non-fluoridated toothpaste. And
okay,
between 3 and to 6 years, then there are special toothpaste for children which contain low level of fluorides. So they should be given these toothpaste, and only a pea-sized amount of toothpaste should be put on the toothbrush, so that even if the child swallows that toothpaste, it is not
Ah.
harmful for them.
The same goes for adults as well, no ma'am, that we should not swallow a toothpaste. जितना भी tasty बनाने दीजिए, so we spit it out. Yeah, and
Normally,
here's
I don't think I've
there's a
seen any.
question here. Okay,
Okay.
how much fluoride content is ideal in toothpaste? So I suppose there are industry standards which toothpaste
Yeah.
companies, manufacturers do follow.
Yeah, yeah, yes. Adults in adult toothpaste, it is 1500 parts per ppm for adults, but that is by the manufacturers only. And the toothpaste which are for children, they normally contain 1000 parts per ppm of fluoride.
Yeah, yeah. ठीक है मैम. नेक्स्ट क्वेश्चन इज मिस्टर नितिन गोडबोले's question. 48-year-old male है. Gum boil in the right lower jaw for the last 3 years. Is surgery required? Is it life threatening?
Uh, Mr. Nitin, if you had this boil for the last 3 years, then I would like to ask him, did he get an X-ray done for that tooth? Did he get an X-ray done? Because that gum boil can be because of a problem in the gums also, and it can be due to a dental caries also. Deep dental
जी.
caries, it will lead to pus discharge through the gum. So he should definitely go to a dentist, get an X-ray done, IOP X-ray, a small X-ray will be taken, and then what is the cause of that gum boil will be diagnosed, and accordingly he should definitely get the treatment for that. Because if
जी मैम.
it
Yeah, yeah. Ma'am, here's Hitesh's question. Hitesh ji is 54-year-old and had cancer in the mouth. After operation, they removed the gum, teeth, and replaced fresh flesh from the leg. Is it possible to implant teeth now? And how many years after the surgery it is possible to have implants?
Oh, Mr. Hitain, yes, implants can be done, but not immediately. After, if he had radiotherapy done, then after 3 to 4 years, they normally implant can be done.
Yeah.
3 to 4 years after radiotherapy. After radiotherapy, and
Okay.
that also it will be decided by the
मैम here's
doctors.
a question. हाँ, रजिस्टर्ड यूजर है, इनका नाम और एज हमारे पास नहीं है. ब्रोकन टीथ बट द रिमेनिंग टीथ हैव अ वेरी गुड बेस. विल आई रिक्वायर रूट कैनल?
The broken teeth have got. Sorry, I didn't
So he
understand the
has
question.
broken teeth, but
Okay.
other teeth have a very good base. Will I require root canal? So this is the only question I have because it's a registered. Somebody has filled in the form and sent in the question. So we don't.
Okay.
I'm not sure if the person is watching the show also. So
Okay.
broken teeth
Because
का root canal का बहुत ही
a
फर्क है
broken
ना.
any broken tooth may or may not need a root canal. If the nerve is involved, if the fracture line is such, then that it is going through the pulp. If there is, if the nerve is involved, then he will need a root canal. Otherwise, a root canal is not required, and he can just go in for a cosmetic filling. Or if the it is fracture is big, then he may need a veneer or a cap, depending upon the fracture site, line of fracture, how big the fracture is.
Yes, ma'am. Ma'am, Vidishna ka question hai and also Ramya. Both of them are asking about wisdom teeth. Vidishna, good morning, ma'am. My both wisdom teeth have started growing and it's very painful. Also, food gets stuck under there. It's very difficult to remove them and then get smelly with bad breath as well. Now, Ramya का question ये था कि इन्होंने wisdom tooth का partially removal करवाया है. Skin has grown over and sometimes it also bleeds.
Ramya, first of all, I partial removal of a tooth is there is no such thing as a partial removal of a tooth. So I didn't understand what she means by a partial removal of a tooth. Maybe she just got the overlying gums removed, because if a tooth is removed or extracted, then the entire tooth is removed. Partial tooth is never removed.
Okay, so maybe
So
they have
they have
bled
just
the
the flap over it, the soft tissue
flap.
flap covering has been removed. Then it depends on what is the age of these of both of them, because normally if they erupt by 21 or 22 years of age. But if the tooth is not in its correct position, it is malaligned, then it may never erupt. which we will come to know by an OPG, an X-ray. So if it is malaligned, then of course it has to be extracted. But if it is
Yeah.
in its normal position, then we wait and watch. Sometimes it may take some time, a few years, but it will erupt.
ओके एंड विदिशना का क्वेश्चन है इन्होंने करवाया नहीं है अभी दे हैव स्टार्टेड टू ग्रोइंग एंड इट्स वेरी पेनफुल
So Vidishna, what is your age? I would like to know if the tooth is in its normal position, and if you are having pain, you can just use warm saline rinses, or you can take some painkillers, SOS. So maybe it will subside, because normally what happens with these these wisdom teeth is that they erupt in spurts. So you will have pain when the tooth is trying to erupt, and then after some time it will subside. Then tooth will go into a dormant phase. Then you will be pain free for many months or maybe a year. And then again, when the tooth will try and erupt, then again you may have pain. So it is like this, but if it is in its normal position, then the tooth will slowly, gradually, after giving you a lot of painful episodes, it may erupt.
Yeah, man, this is a phase of life which one dreads. The wisdom tooth का I don't know why it's called wisdom tooth, but पूरा ज्ञान तो जाता ही है उसके साथ the kind of pain
It
that it gives.
seems you have had a problem with your wisdom teeth.
Yes, ma'am. Yes. All right. Ma'am, here's Rajesh Parekji's question. One of the senior citizen, 72 years wants to get all the teeth removed and get all the teeth to be implanted. Is it safe?
It is safe, but we have to see. There are many things that have to be seen before an implant is done. As per se, the procedure is safe, but we have to see that there are many underlying conditions which should not be there. For example, you should not be a diabetic. If you are a
Gee.
diabetic, then uh, the implants may fail even if they are done well. Then you should be a non-smoker. With smokers also, it causes implants to fail. Then before doing implants, there is a special X-ray which we take, which is known as a CBCT, which is a
Yes.
must, so that we check what is the density of the bone, how strong the bone is, what is the depth of the bone, whether it will be able to support the implants or not. So all these things have to be checked before we go in for an implant, whether a person's bone and general health is suitable for an implant or not. That is very important to see. A CBCT before an implant is a must, and the
Yeah.
patient should not be a diabetic and should be a non-smoker, and he should take, after implants you have to really take good care of your implants, otherwise they may get infected and then they may start falling off.
So, ma'am. Ma'am, here's a question from Deepak Harminder. These are asking about RCTs, root canal treatments. Deepak Gurram asks, will RCT make the teeth weak? And Harminder ji पूछते हैं, root canal काफी expensive है. And somebody else is also asking, are there any alternative to RCT? And किनका नाम था ये? I've got somebody. Somebody was asking, are there anything else for implants, alternative for implants? उनका नाम मुझे दिख नहीं रहा है, but alternative to implants and RCT.
So what I would like to say about RCTs is that if the caries or a cavity or the decay has reached up to the nerve, then there are only two options. Either you go in for a root canal treatment, or you go in for a or for extraction. No
Okay.
third option is there. No third option is there. And what now we suggest is that it is always better to save the tooth rather than get it extracted. Because if you get the tooth extracted, then you will need to replace the tooth. If you do not replace the tooth, then later on you will get other problems will start developing. So
जी.
if the so there is the only other substitute for root canal is extraction. And if a root canal is possible, then I would suggest that everybody should go in for a root canal treatment. And of course, the tooth becomes a little weak, but then it lasts for, if done properly, if the procedure is done properly, then it lasts for many, many years. But definitely get a crown. Crown is
Yes.
mandatory after a root canal treatment.
Yeah. Ma'am, here's Rafi, 23-year-old male, having tooth clips adds any kind of value in terms of health, or is it only cosmetic and aesthetic purposes? I think clips in the sense he's asking about braces, ma'am.
Basis, yes, yes. So Rafi, no, teeth has many functions to perform. Aesthetics is one of them, and function is another important thing. So many people, they have got aesthetics, of course, is there, but if the teeth are malaligned, then it leads to many other problems later on in life. Maybe at a young age you will not have those problems. If there is for example, if there is a lot of crowding, then food will keep getting impacted, you will keep getting periodontal problems, teeth will become mobile. If the teeth are protruded, then with passage of time, if you don't get it treated, the protrusion will keep on increasing. So there are many things, many functional problems which develop if you do not have proper set of teeth, if the alignment of teeth is not good. So you should definitely go in for orthodontic treatment, not only for aesthetics but for functional purposes also.
मैम ये ब्रेसेस के बारे में या अलाइनर्स के बारे में भी इतना सारा मिथ्स है कि दर्द होता है, लॉन्ग टर्म होना चाहिए, स्टेन्स हो जाते हैं. लॉट ऑफ पीपल फियर कमिंग टू अ डेंटिस्ट ऑल्सो, एंड आई हैव नोन पीपल हु हैव स्टॉप्ड, you know, prescribed time duration hota hai. I have seen people who have discontinued using. So what suggestion that you would want to give, ma'am?
देखिए, फर्स्ट ऑफ ऑल तो आई वुड लाइक टू टेल यू दैट if you want to go in for braces, then you should only go to an orthodontist. All dental surgeons, they will not be able to do. They are specialized dental surgeons, though those who are called orthodontists. So if you are getting braces, definitely get it done by an orthodontist. So that is the most important thing. And then there are many ways in which crooked teeth can be aligned. It is by braces, it can be by removable appliances, and now the latest is aligners, which is something which is transparent. So the advantage of aligners, there are many advantages of aligners. The thing advantage is number one is that you do not need to go regularly, very frequently to the dentist. Some people, they are staying away, they cannot come very frequently, or they cannot come once in a month. Then even if you are coming once in 3 4 months, it is good enough. That is the And then secondly, it is absolutely transparent. So people who are working, or those who are into some other business like modeling and all, they do not want that it should be seen. So they can go in for aligners, which it is absolutely transparent. And the third thing, that's nothing is, we don't stick anything onto the teeth. For example, in braces, there are small steel brackets which are fixed onto the teeth. So once you remove the brackets, it damages the tooth a little if not done properly. But in braces, what is in aligners, you are not sticking anything onto the teeth. These are small silicone type uh, mm, uh, trays
Jawline shape
trays. You
cases.
just slip it on, and then while eating you can just remove them, so you can eat properly, and then you can just put them on. But the disadvantage of these aligners is that it has to be worn for 21 hours at least in a day. So people, what they initially, they are very excited, very motivated, they wear them properly, but after some time, then because it is not in the hands of a dentist that the patient has to see that he is wearing them regularly. So after some time, I have seen that the patients, then they, what they do is they start getting lax, they don't wear them, and then everything goes haywire. This I've seen
G.
many times. Or
Yeah.
if you take tea, coffee, or drinks with the aligners on, then they will get stained. So then they will not be transparent, they will become visible. So
Yeah.
this is the main disadvantage of aligners, that you have to be very motivated and wear it 21 hours or 22 hours a
Yes.
day.
Yeah, one quick last question before I leave you for top tips, ma'am. Priya Gopinath and somebody else also was asking कि ये जो pulling, oil pulling है या practices like using salt, turmeric, baking soda और mouth washes like multiple brands में मिलते हैं, इन सब का use करना सही है या नहीं है?
Um, I don't know much about oil pulling. Many people who use it, they say it is a very, very good thing. But in medical, as such, in our scientifically, I don't know how good or bad it is. But I've read studies; they say it is very effective. So that I will not be able to. I've never used it. Neither I have ever prescribed it to any of my patients. So I would not be able to tell you much about oil pulling, but definitely brushing with salt or something is a big no no. Nobody should use salt because it is highly abrasive. It causes abrasion of teeth, the enamel wears off, and then you start getting sensitivity. So nobody should use no salt, no tooth powder should be used. They should only toothpaste should be used. Nobody should ever use any tooth powder or salt. It causes severe
Great, ma'am.
abrasions.
Thank you, ma'am. Thank you so much for this detailed information that you have taken time out for. And I would now want you to give us top tips to take care of our oral and dental health.
Okay, okay. So I would say that five things I would like to say. Number one, brush your teeth 2 times every day, in the morning after breakfast and after dinner. Number two, use a fluoridated toothpaste. A fluoride toothpaste should be used. Number three, use dental floss. A dental floss is a thread like thread used to clean in between the teeth, and dental floss should be used once after dinner before going to sleep. Number four, sugar exposures should be kept to three, not more than 3 times in a day. So, sugars or sugary things or tea with sugar, everything is included in that. We should not take sugar exposures more than 3 times in a day. And number five, it is mandatory. Everybody should visit a dentist once in 6 months so that whatever problem is there initially, because initially dental problems, there will be no pain. So we will not come to know that we are suffering from any problem. So it is, if you go to a dentist, they can be taken care of at a very early stage with very less and time and energy will be required, less money will be required, no medication will be required. So visit a dentist once every 6 months.
Great, ma'am. Thank you so much. It is a Sunday morning, and I know that this is a very valuable time of yours, and we appreciate your time, ma'am.
Thank you very much. I hope people have gained from what I have told
Oh,
them. I hope it has been
yes,
helpful.
ma'am. There's so much of appreciation and thank you, the posts which are appearing here, and I
Okay,
thank all the audience, ma'am.
thank you. I'm so happy to listen, hear this. Thank you.
Yes. Thank you, ma'am, once again. Namaskar. Thank you.
Namaste.
So that is Dr. Amita Agarwal for us. And now this is your chance to win Health Quiz coming up. Answer the questions over the YouTube chat only. Winner's name will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. And if I take your names as winners, you have to write back to us with your contact details to marketing at apollo247.com and our gift vouchers, which are health credits, which will be shared with you. चलिए आज के questions, 3 questions, we're going to place them on the screen for you. True or false में answer कीजिए. The first question is, tooth prints are like fingerprints, unique to each person. Is it true or false? Question number 2, fill in the blank please. Not brushing twice a day increases the risk of tooth dash. Fill in the blank. Question number 3, yes or no में answer कीजिए. Is tooth enamel the hardest substance found in the human anatomy? Yes or no? I repeat the questions. True or false में answer कीजिए. Question number 1, tooth prints are like fingerprints, unique to each person. Question number 2, fill in the blank please. Not brushing twice a day increases the risk of tooth dash. Fill in the blank. And question number 3, yes or no में answer कीजिए. Is tooth enamel the hardest substance found in the human anatomy? These are the three questions. Go ahead. I see a lot of people who are regular viewers who are waiting for the health quiz are typing in already. So, chaliye, in the meanwhile that people start answering their questions, let me give you health gift vouchers from Apollo 24/7 as well. The first one that we are giving you today is Ask Doc 150. The code that you need to use on Apollo 24/7 is ASKDOC150. You can consult top doctors direct from Apollo hospitals and get up to 150 rupees cashback on online doctor consultation. And the next one that we are giving is First 3 FIRST First 3. Use this code on Apollo 24/7 app to order medicines directly from Apollo hospitals and get up to 25% off on online medicine orders on the first 3 medicine orders which are value above 1000 rupees. You can also get up to 2-hour delivery on Apollo 24/7. The next one that we are giving is exclusive for our Health Hour viewers. Use the code HH247 and get up to 199 off on online consultations with Apollo doctors and up to 20% off on medicine orders as well. Thank you all of you. And by the way, let me also remind you that Apollo 24/7 can be accessed just a call away. You can access now on WhatsApp. You can text or call on 9355247247 to avail all the healthcare services. And you can also book the packages which are especially curated by Apollo Health experts. The ticker is being running. You can go back to the show and check in case that you would want to book any tests, or if you want to consult Dr. Amita Agarwal, the link will be given. And I also urge you all to subscribe this channel because we give you a lot of information and information is power, and every week you get to meet an Apollo's health expert. तो लाइक कीजिए, सब्सक्राइब कीजिए और शेयर भी जरूर कीजिए क्योंकि पता नहीं ना किसको क्या जरूरत होगा. तो आपके क्वेश्चंस पूछते रहिएगा बिकॉज हम पावर देंगे सबको इंफॉर्मेशन का. बाय द वे नेक्स्ट वीक का भी एक इंटरेस्टिंग टॉपिक है. लेट्स सी व्हाट द नेक्स्ट वीक्स टॉपिक इज. वी आर गोइंग टू टॉक अबाउट बैक एक, पीठ दर्द के कारण और उपचार बात करने वाले हैं. 26 मार्च संडे 11 AM. जॉइन अस. ये एपिसोड हम स्पेसिफिक रिक्वेस्ट पर हिंदी में ही करने वाले हैं. तो आपके जो भी क्वेश्चंस हैं प्लीज लाइएगा. हम पीठ दर्द, कमर दर्द, ऑल बैकएक रिलेटेड क्वेश्चंस के बारे में आंसर करेंगे. एंड लेट्स सी हु आर विनर्स फॉर दिस वीक आर. Congratulations winners, Sean David, Bhanu Prakash and Lavanya CNM. Sean David, Bhanu Prakash and Lavanya CNM. आपके नाम चैट बॉक्स में भी डाले जाएंगे. Please do write back to us at marketing@apollo247.com to claim your health credits. Thank you so much all the audience who have joined us this Sunday morning, and we shall see you next Sunday. Namaskar.